Welcome, everybody, to today's episode of The Lindsey Elmore Show. First up, I interview my friend, Dr. Lauren Castle. She is a pharmacist like me, and she also has a master's of science in functional medicine. And we talk about her personal journey to make wellness more affordable because, dang it, being well should not be expensive. And then I share with you some of my reflections about doing the Institute for Functional Medicine training, which has been a swift kick in the pants, to say the least. And it has been a humbling experience. And I encourage you all in that segment to continue your education for a whole bunch of reasons. Let's get to the show. Welcome to The Lindsey Elmore Show, a podcast that helps you find fulfillment amidst chaos. On this show, I interview thought leaders, doctors, creatives, spiritual gurus, and game changers who inspire you to pursue your dreams, overcome obstacles, and leave your mark. Dr. Lauren Castle completed her doctorate of pharmacy from Ohio Northern University in 2013 and completed her master's of science in functional medicine and human nutrition from the University of Western States in 2018. She currently works as Market Health and Wellness Director for Walmart and serves as a social media influencer for the company. She is the founder of the Functional Medicine Pharmacists Alliance, whose mission is to integrate pharmacists into the practice of functional medicine and functional medicine into the profession of pharmacy. Today, we talk about why pharmacists need to be involved in functional medicine and go through Lauren's own transformational journey using functional medicine to get down to the root causes of all of the issues that she and her husband were facing. She wants to ensure that pharmacists have a seat at the functional medicine table. How can we make functional medicine affordable and accessible for all people? Let's get to my interview with Dr. Lauren Castle. Dr. Lauren Castle, welcome to the Lindsey Elmore Show.
Thank you for having me, Lindsey.
I'm so excited to have you here today to talk all things functional medicine. And I wanted to just start out by telling you the definition of functional medicine according to Wikipedia. Are you ready for this? Functional medicine is a form of alternative medicine that encompasses a number of unproven and disproven methods and treatments. And so for us as pharmacists, it's a little bit bizarre to be in the functional medicine realm. And I think a lot of people are like, wait a minute, that totally discredits what you're doing. But we know that functional medicine has a place. And we also know that only about 0.3% in our unofficial poll of pharmacists have any concept of functional medicine. So why do you think that pharmacists would want to get involved in functional medicine? Why do you think there is this inherent distrust of functional medicine as a way to help patients recover from diseases? And why are pharmacists not recognized in this space and in this arena?
Absolutely. So I myself, when I first discovered functional medicine, was extremely skeptical. So I had someone put a flyer on my door about an integrative wellness center that could cure all of these symptoms, which sounded like my husband on paper. So that was how I first discovered functional medicine. And I had the same questions, what is this? And the first thing I did was Google it and found the exact same Wikipedia definition that made me really think, okay, this is not legit. I just, no. But once I actually started reading a little bit more and I found more reputable sources such as the Institute for Functional Medicine and discovered that, in fact, this is such a new science that there's more work being done to increase the evidence base for it. And that is what the role of the Cleveland Clinic Center for Functional Medicine is fulfilling. So once I realized that, okay, well, if Cleveland Clinic is doing functional medicine, there's got to be something to that, right? So being from Ohio, if they're doing it, it's a big deal.
Yeah, it's a wonderful hospital system. It is.
Yeah. So that kind of gave me a little bit more peace of mind. And for me personally, what really convinced me that, this is the future of medicine, as they say, is personal experience. And I think that 0.3% of pharmacists who have discovered functional medicine, 99.7% of them have discovered it through a personal journey and a personal experience with being healed from maybe some of their own conditions, that has led them to say, I found a better way to help my patients heal.
I know. I love the concept in functional medicine that you mentioned is it's custom. And I think that makes it dramatically different than other conventional medicines. Conventional medicine is what we're taught in pharmacy school, which is all patients get the same drug therapy, and you just titrate that drug therapy to optimize these endpoints. But there's no look at individual biochemical factors or looking at how the mind, body, spirit connection comes into play, all of those things. So were you one of those pharmacists that had a personal health journey, or was this all purely academic for you when you came into functional medicine?
So interestingly enough, it was both. One, like I said, it was really my husband that made me think, okay, he's got all these different symptoms. And if I were to try and treat them as a pharmacist, conventionally trained, I'm going to throw an antihistamine on his allergies, a sleeping pill on his insomnia, and maybe some, weight loss drugs to try and help him lose that weight that doesn't seem to be falling off, even though he is following the traditional, conventional dietary guidelines and working out 5 days a week for 30 minutes a day at his gym. Yeah. So why isn't it working? Why aren't we getting better?
Yeah.
And that is what we found. Once we actually went through this process and learned about functional medicine, went through a 12-week program, did an elimination diet, discovering that skim milk and whole wheat bread that he had been eating every day as part of his diet was actually causing the inflammation that was preventing him from being able to get over those symptoms and lose that weight. So eliminating those things, and then also getting to root causes that you would probably never discover through a conventional approach, things like candida overgrowth, those types of things that we aren't really exposed to and don't learn in a traditional setting, is what truly set this apart and made me realize that, one, pharmacists can absolutely be trained in how to do this. And that was kind of what started my personal journey in this, is, okay, I want to make sure that all of my patients that I see, even in a community pharmacy setting, have an opportunity to learn about this and can take their health into their own hands and have that partnership to get over whatever types of chronic conditions they might be struggling with.
So take us back to those first elimination diets, because I'm sure plenty of our listeners are like, wait a minute, I have mild allergy and insomnia and I can't lose weight even though I'm working out every day. Probably a lot of listeners also have autoimmune and thyroid dysfunction, etc. And I think the concept of an elimination diet is very scary. We don't want to be told what to eat, but what are the basic tenets of an elimination diet? Why, when you first start a functional medicine journey, is this basically every clinician's first step? Is like, okay, you're here, you're telling me all your symptoms, you're going to do an elimination diet. And in the meantime, we're going to get your labs back and then we're going to know where to start. And it's honestly astounding how many people within a week or two of an elimination diet feel like 90% of their symptoms are better. And so what are the basic tenets? Why start with an elimination diet?
So an elimination diet can come in many different forms. Some of the more popular ones that people do out there are on the internet. There's all types of versions of cleanses. And really the premise of it is to reduce your inflammatory foods to a point where your body can actually get rid of those antibodies that you have to them that are going to show up on a food sensitivity test. So until you do an elimination diet, if you're doing a food sensitivity test, there's a lot of people who are going to actually trigger for some of the common foods that they eat regularly that may or may not be as inflammatory to them, but just because they are so overexposed to them, it can make it very hard to interpret those. So that's one thing where, there's a lot of questions about food sensitivity testing and are they accurate or not. You really need to start with kind of the elimination diet to even get the true best results from those types of tests. So that's one aspect of it. But really, you're going to be looking at your most common inflammatory foods. So things like wheat, soy, peanuts, nuts in general, seafood, those types of things, even corn.
Sugar, dairy. Yeah.
It's all of those things. So getting those inflammatory foods out there so we can figure out what you truly are sensitive to, not necessarily allergic to, but sensitive to, meaning that your body has a response to them that's inflammatory, but also giving your gut a chance to heal. So again, if you don't do things in the right order from a functional medicine approach, which using a functional medicine lens, you learn a specific order that you want to approach a patient's treatment plan to. Because if you do it out of order and you try to heal the gut before you've even had a chance to remove the offending foods, you're not going to see those improvements. So you've got to heal that gut lining by removing first before adding back in. So I think that's another area where sometimes there's misconceptions or people don't have success doing what they think is a functional approach when really it's more integrative and they're just layering on a million supplements and you're polysupplementing instead of actually getting to the root cause, treating inflammation first, removing the offending agents first, and then getting into supplementing and a healing treatment plan.